Well, it's only Monday and my water's boiled already. Now, we know we've already got a problem with the NHS dentists in the UK. You can't get one. It's been around 10 years since I've been able to register anywhere with a dentist. Newcastle city centre, the outskirts, and over in South Tyneside also couldn't get registered with an NHS dentist. It was all private, which means you have to pay for appointments, pay for your everything. My water's boiled this morning because my sister sent me a photograph and her face is swollen so much. Our GP's diagnosed an abscess. If you need to see a dentist. So she's been diagnosed, and apparently there's 2 different types of antibiotics she was told that can be taken, but they're not allowed to prescribe it. So she'd have to see a dentist. Feeling that, she'd have to go to the hospital. So she was given a letter. She's coming up 60. She's of ill health. She's had a heart attack. She walks with a stick. Very painful for her to walk. She has an issue with her knee. She had an accident when she was 16. And it's shown in later life. Shown up. She's been on 6 buses already. Backwards and forth to different places. Trying to get this sorted. Trying to get help. And everyone's turning her back. And when our GP told her to go to the hospital, last point of call, because she's done the 111 and all this lot, the hospital said, no, they can't help her. And she said, well, my GP told her to come here. One of the receptionists has said, well, you wouldn't get a plumber out to do an electrical job, would you? In other words, you don't come to the hospital if you need a dentist. I'm shocked. I'm shocked at whoever that was. Get her off reception. That's not customer care. That's not a customer-focused attitude. So she's on her way home right now as we speak on our last bus. And our only resort now is to ring, she lives over in Gateshead, is to ring Newcastle Dental Hospital. Now you have to make an appointment at that dental hospital. But that used to be an emergency dental treatment. Now you have to make an appointment to get there. Why is that? Because nobody can get a dentist. So I've looked up. And here's what AI says about dentists in the UK. Finding an NHS dentist is difficult because the 2006 NHS dental contract pays surgeries a fixed amount based on units of dental activity, UDAs, rather than actual costs or time. This underfunding, combined with rise in practice overheads and severe dentist shortages, means clinics lose money on NHS work and stop taking new patients. The flawed contract system. The 2006 payment model groups complex procedures and simple checkups into the same fixed bands, meaning dentists receive the same pay regardless of how many fill-ins or hours a complex procedure requires. Practices face strict UDA targets. If they miss them, they're unpaid. And if they exceed them, they don't get any extra funding for extra work. Underfunding and capacity limits. Government funding for dentistry has fallen over time, meaning the budget only covers dental care for roughly half of the UK population. Rising costs for utilities, staff and laboratory fees make running an NHS dental practice financially unsustainable for many. Millions of adults across England, myself included, and my sister, remain unable to secure an NHS spot, leading many to turn to private care or go without treatment. We've gone without treatment. Can't afford private care. You've got to pay for your appointment, like I said. You pay for your appointment and you've got to pay for your whatever you're getting done. You've got to pay for prescription. People can't afford that. This needs to be looked at. This is horrendous. You know, we can all slag dentists, but if they're running at a loss and they can't because of the way things for the NHS funding from the government is set out, That needs severely looked at. Emergency, I would say, now. How many of you in the UK have not been able to get registered with an NHS dentist? I'd love to know. I'd love to know the count. Half of the UK cannot get dentistry. Your smile is important, not just for cosmetic reasons. You're going for a job interview. You're speaking to a client. You're speaking to a customer. It's part of what helps give you confidence. So what are your thoughts? Like, my water's boiling for my sister because I've seen her face. I've seen how swollen it is. So what my fear for her is, her face keeps filling up. What's going to happen? How much pain is she going to be in? It's just not on. It's not on. Okay, so I've had a quick search. What is the government doing about NHS dentists in 2026? So here we go. In April and June 2026, the government introduced a major overhaul of the NHS dental contract in England. The reforms mandate that practices dedicate 8.2% of their contract value to urgent care, establish standardised payment pathways for complex treatments, increase funding for preventative care like fissures, sealants, and roll out supervised toothbrushing for young children. Key changes. Guaranteed urgent care practices must deliver unscheduled urgent care backed by a new national flat rate payment structure of £75 per urgent case rather than older unit formulas. Complex care pathways, standardised packages and enhanced fees were introduced to better fund high-need patients requiring extensive work for severe decay or gum disease. Prevention focus. Fissure sealants were reclassified and trained dental nurses gained permissions to apply fluoride varnish to free up dentist time. Public health initiatives. An 11 million national supervised toothbrushing scheme targets children aged 3 to 5 in deprived areas. £11 million is spent on a national supervised toothbrushing scheme. Parents should be teaching their children how to brush their teeth. Schools can teach the kids how to brush their teeth without having to put that in as part of their general teaching thing, can't they? 11 million. Could that not have been put into the NHS dentists? Apparently, this toothbrush thing will support 600,000 children this year, with over 4 million toothbrushes and toothpastes delivered already. Like, toothbrushes and toothpaste are the least of our problems. That's with parents' responsibility to purchase those things. And the schools, the parents and the people around them, about the dental health, the hygiene. We need more dentists. Minister for Care Stephen Kinnock said, "We inherited a broken NHS dental system and have worked at pace to start fixing it, rolling out urgent and emergency appointments and bringing in supervised toothbrushing for young children in the most deprived areas. Now we are tackling the deep-rooted problems so patients can have faith in NHS dentistry. These changes will make it easier for anyone with urgent dental needs to get NHS treatment, preventing painful conditions from spiralling into avoidable hospital admissions. This is about putting patients first and supporting those with the greatest need while backing our NHS dentists, making the contract more attractive and giving them the resources to deliver more." He said this marks the step towards a new era for NHS dentistry after a decade of decline, one that delivers for patients and our dedicated dental professionals. Literally, like 11 million going in for those toothbrushes and stuff. I hear what they're saying, deprived areas and things, but we've not been able to get NHS dentists. And like I say myself, I'm in my 60s now, for nearly 10 years. My sister has not had one for years, can't get one, can't get the care. It does help, goes into gum disease, goes into all these different things. We need the dental care. We just do. We don't need to be wasting money on things that Parents should be providing. That's their responsibility. The nation needs fucking dentists. And clearly, nobody's taken in any emergency. Uh, like I said, I've explained my sister's situation. Like, what's going on there? It's absolutely ridiculous. So, what's your thoughts? 11 million into toothbrushes and toothpaste for 3 to 5 year olds when the parents really should be responsible for that, not the taxpayers. That's where all the money's coming from, isn't it? The taxpayer money. It's the parents' responsibility, and the schools for teaching and the people around them. We need dentists. Have you had difficulties finding a dentist, getting registered? What have you done when you've had situations? I mean, literally, we're going on and we're finding our own medications online. We're pulling our own teeth. We're putting our dental care, our hygiene, and our health in jeopardy. We'd like to hear your thoughts on the situation, especially if you're a UK person who hasn't been able to get a dentist. What have you done when you've had issues with your gums or your teeth? Write in, let us know. Coffeesoulpod@gmail.com.